Thanks. Good morning, everyone. I'm presenting on behalf of Medicine One. It's titled Unstable. Presenting history of a 29-year-old female from Katpadi who presented with complaints of fever for 5 days, loose stools for 5 days, giddiness and vomiting for 5 days. She had fever from day 1 to day 4 of illness. It was a low-grade fever with no chills or rigors, associated with generalized body pain and headaches. Since the 5th day of her illness, she has become afebrile. From day 2 to 4 of illness, she complained of small volume watery loose stools, around 4 to 5 episodes per day with no blood, mucus, or tenesmus. From day 2 of her illness, she also started experiencing vertigo with 10 to 12 episodes of non-bilious, non-bloodstained vomiting and imbalance on walking 2 days prior to presentation. On examination, her pulse rate was 90 beats per minute, blood pressure was 118/70, respiratory rate was 20. She had pallor, but there was no icterus clubbing cyanosis, lymphadenopathy, or pedal edema. There was a generalized blanching erythematous rash that was noted on her back, abdomen, and the limbs. System examination CNS examination showed normal cranial nerve examination with normal tone, power, and reflexes in all four limbs and bilateral flexor plantars. She had a nystagmus, a horizontal nystagmus, which was more on looking to the right side. Finger nose testing and dystidacokinesia was negative. When she was asked to walk, she was noticed to have a swaying to the left side and she was unable to perform the tandem walk. There was no neck stiffness or spinal tenderness. Rest of the system examination was unremarkable. So syndrome that she presented, a young lady with no comorbidities who presented with an acute febrile illness with an exanthem with GI manifestations and cerebellar symptoms and signs. So our differentials were mainly tropical illnesses like dengue fever, enteric fever with aseptic meningitis, or a scrub typhus with meningeal involvement. Investigation showed hemoglobin of 11.9, total counts of 3,400, which gradually improved during the ward stay. Differential count showed lymphocytosis, 57% lymphocytes and monocytosis, and platelets at presentation was 1.4 lakhs. And as she was during her ward stay, she was afebrile, and the platelets showed a gradual reduction. Her renal function was within normal limits, and LFT showed slightly elevated levels of SGOT and SGPT. Since dengue was one of our top differences, we sent off the dengue serology for her, and the dengue NS1 antigen was positive. Because we were suspecting CNS manifestations of dengue in her, we sent off, we did a lumbar puncture, and it showed 3 WBCs with 80 RBCs and CSF glucose of 83 and CSF protein of 29. We sent the CSF for multiplex PCR, which was negative, and for interest, we sent for the dengue PCR also on the CSF, which came out to be positive. We did an MRI brain, which showed subtle flare hyperintensities in bilateral cerebellar hemispheres along the inferior and medial aspects without any restricted diffusion and post-contrast enhancement, which was suggestive of an infective etiology. So I just wanted to, we diagnosed her finally with dengue with no warning signs, but with cerebellitis. So I looked at neurological. I just want to focus on neurological complications of dengue infection. It can affect your central nervous system as well as your peripheral nervous system. And in the central nervous system, it can present as encephalitis, where they have acute signs of cerebral involvement, encephalopathy, where they present with cognitive disorders, convulsions, mood and personality disorders, meningitis, where they have acute fever with headache, vomiting, nuchal rigidity, And other set of syndromes are ischemic strokes or hemorrhagic strokes, where they present with focal neurological deficits, headache, vertigo, vomiting. Cerebellar syndrome, where they present with bilateral vertical and horizontal nystagmus, dysarthria, bilateral limb and gait ataxia, has also been seen associated with dengue. They can also have transverse myelitis, where they present with rapid, abrupt onset motor, sensory, and spatial disturbance. And you can see spinal lesions extending over 3 vertebral levels. And acute disseminated encephalomyelitis is a inflammatory demyelinating disorder that is associated with dengue infection. So the cerebellar syndrome that is usually associated with dengue is seen within 2 weeks of diagnosis. They usually present with bilateral vertical and horizontal nystagmus, dysarthria, bilateral limb and gait ataxia, and they were usually self-limiting disorders. The MRI brain tends to show cerebellar T2 hyperintense lesions. CSF has been shows normal protein levels with normal cell counts, and we have it is associated with positive antibodies for dengue in blood and CSF samples. A low-grade inflammatory process was the proposed mechanism for a dengue for the cerebellar syndrome associated with dengue infections. So management-wise for dengue cerebellitis, it's just like how we manage normal dengue fever. There's no definite antiviral agents. We need to monitor their counts, replace fluids as necessary, but it can take months to resolve. So our patient, we treated her with IV fluids and monitoring of platelets only. And she had come back to OPD last week, but she was still having the vertigo. So we had started her off on Vertin for the same.
Does she have vertigo or ataxia?
She has vertigo. It was near discharge when it picked up to 59%.
Why did we do dengue PCR and CSF? Why did we do multiplex PCR and CSF? Oh, okay. Because I was wondering, because it doesn't make any difference in your diagnosis and or treatment. We all know that we get neurological complications. Imaging is shown. Okay, it's done as a part of the study. What I would have liked to know is what is generally in patients who come with neurological symptoms of dengue, what is the prevalence of the CSF antibody being positive?
The study that I referred
that is
to
2 patients with cerebellitis.
2.64% was the prevalence of neurological complications, but antibodies in CSF, I'm not sure.
Any comments?
Yes, the study that we published, John published CNS manifestations of in dengue. I think there's about 1,121 patients, 30 had encephalopathy, 27% had encephalitis, 17% had cerebellitis. That might be something that, because it's more relevant to us as opposed to studies that have only 2 patients. But I don't know if we did the qualitative PCR for a lot of them.
Might not.
Yeah.
I did my basic patients.
Yeah.
Close to the meeting. Thank you everyone for attending. Thank you for all the presenters for interesting cases. In terms of content, form, and delivery of the presentation, I think the best presentation goes to Dr. Amit from hepatology. Thank you.